Welcome to Health and Wellness. I'm Will, nurse practitioner, and today we're going to be talking about an emergency nurse practitioner, or ENP. What are they? What do they do? How much do they make? And how do you actually become one? So if that sounds interesting to you, be sure to like this video and keep watching. So what exactly is an emergency nurse practitioner? So an emergency nurse practitioner, or an ENP, is a nurse practitioner who works in the emergency department or a similar setting like an urgent care. So they see patients in the emergency department, both in fast track areas as well as on the main side, trauma centers, urgent cares, jails and prisons, retail health clinics, and even mobile units like flight teams. And what kind of work does an ENP do? So an ENP does exactly what you'd think they do in these settings. So they're a nurse practitioner, so they're seeing patients, evaluating them, and treating them for various diseases and conditions which would prompt somebody to present to the ER or urgent care type setting. So these are anything from chest pain, abdominal pain, headaches, to infections, upper respiratory infections, extremity injuries, all of the above. An ENP will also perform various bedside procedures like laceration repairs, incision and drainage of abscesses, splinting, shoulder reduction, administration of regional anesthetic blocks, etc. They'll also be trained in emergency and critical care procedures like rapid sequence intubation, central line insertion, and chest tube insertion. They'll usually be working in conjunction with an attending physician, especially in the emergency department, but not all the time in an urgent care. So how much money does an ENP actually make? Well, you can definitely expect to make six figures. ZipRecruiter says that the average ENP will make $133,000 per year, or $64 an hour, assuming a 40-hour work week. But most ENPs or emergency providers aren't actually working 40 hours a week. A lot of times they'll work between 30 and 36 hours per week, unless they're picking up overtime. So compare $133,000 per year to the general nurse practitioner salary of $110,000 per year, and you're looking at a pretty significant increase in pay in the emergency department setting. However, it doesn't come without its risks as well as its drawbacks. The emergency department setting is stressful, comes with higher risk, and typically has less favorable hours. So honestly, the increase in pay makes sense. Many ERs and urgent cares will utilize an RVU-based system. So basically, the busier you are, the more procedures you're doing, the more patients you're seeing, the more money in bonus you'll get. So now that we know what an ENP is, what they do, and how much they make, how do you actually become one? Now, ENP is generally a newer certification, and there are a few different routes you can take. However, the first step, regardless, is to become a registered nurse. This deserves its own video in and of itself, but long story short, you're going to have to attend an RN program, usually a Bachelor's of Science in Nursing, which is a 4-year degree. Then when you graduate, you take the NCLEX RN. Once you pass that, you can be licensed in your state as a registered nurse, and you start working as an RN. So once you start working as a registered nurse, you need to get into the emergency department if ENP is your goal. And this is for a few different reasons. First and foremost, if you want to go to an ENP program, it's going to require that you have at least 1 to 2 years of ER nurse experience. Not only that, working in the ER is going to develop your assessment skills. You're going to get comfortable about what kind of patients are presenting to the ER and what kind of treatments might be ordered for them. And it can also give you a chance at rethinking your life decisions. Maybe you think the ER is too stressful, and once you're working there, you're like, nah, I don't want to do this forever. Maybe I'll be better off in a family clinic.
Ask you how you are, you just have to say that you're fine when you're not really fine, but you just can't get into it.
So here is where we have some different options into becoming an ENP. The first and probably easiest way to become an ENP is to attend an ENP program. Now, while this is a newer certification, there are more than 10 schools that offer this in the US, and all of them, as far as I'm aware of, do both dual FNP and ENP. So you will never really see a solo ENP program. It's almost always in combination with an FNP. And this kind of just makes sense because patients who present to the ER a lot of times are primary care complaints as well as pregnant patients. So while you attend an ENP program, the content is very ENP focused. These programs will typically take you about 3 years to complete, and you'll complete between 600 and 1,000 plus hours of clinical. Most of your clinical rotations will be in an emergency or urgent care type setting, as well as family practice, OBGYN, and pediatric settings that you get with the FNP curriculum. Many nurses do continue to work per diem or part-time throughout their program, and this can help both financially as well as it's almost like a little extra clinical hours. No, you're not seeing patients as the provider formulating treatment plans, but it does kind of help you put what you're learning into practice. So the other option you have is if you are already a family nurse practitioner. you have two real options. You can either attend a postmaster certification in emergency nurse practitioner, or you can apply by portfolio. So what this means is that if you have enough work experience and continued education, then you can apply to take the EnP certification exam. And these work requirements are at least 2,000 hours of work in an ER or urgent care type setting within the last 5 years, and at least 100 hours of continued education in this setting as well, with 30 hours being emergency procedures. And the last way, if you're already a nurse practitioner, you can attend an EnP fellowship or residency, at the end of which you will be able to sit for the EnP exam as well. And these typically last 1 to 2 years. The final step to becoming an EnP, regardless of which route you took, is to take the EnP certification exam by the AANP, the American Academy of Nurse Practitioners. The EnP exam consists of 150 questions, 135 of which are scored. These questions will be about medical screening, so your history and physical of an ER patient, your medical decision making and differential diagnosis, so your thought process of what you need to order and which emergencies you need to rule out for which presenting complaint, as well as the patient management and disposition. So what are you doing for them? What medications are you giving them? What treatments are you giving them? And where is the patient going when you're done with them? Are they going to need to be admitted to the hospital? Can they safely be discharged? Do they need to be transferred? And there are some questions involving professional, legal, and ethical considerations. So once you pass this test, you are a certified emergency nurse practitioner, and you can apply for your state licensure as an advanced practice registered nurse. And there you go. That's how you become an EnP, what they are, what they do, and how much they make. If you like this video, be sure to like the video down below and make sure you subscribe to my channel and comment something down below about emergency nurse practitioner. Is it something you want to do? Let me know.